Synagis is an important medication that has been prescribed for infants at risk of severe respiratory syncytial virus (RSV) infections. As a concerned parent or caregiver, you want to know more about the benefits and potential side effects of this medication to make informed decisions for your child's health. Look no further, as this video is here to provide you with everything you need to know about Synagis. In this comprehensive guide, we will delve into the benefits of Synagis, exploring how it helps protect vulnerable infants from RSV infections and potentially life-threatening complications. We will also discuss the potential side effects that you should be aware of when considering this medication for your child. With accurate and up-to-date information, we aim to empower you to have meaningful conversations with your healthcare provider about the use of Synagis. By understanding the benefits and potential side effects, you can make informed decisions that prioritize your child's health and well-being. So, let's dive in and explore the world of Synagis together, ensuring the best possible care for your little one. What is Synagis? Synagis, also known as Palivizumab, is a monoclonal antibody medication that is used to prevent severe RSV infections in infants and young children. RSV is a common respiratory virus that can cause mild cold-like symptoms in most people. However, in premature infants and children with certain medical conditions, RSV infections can lead to serious complications such as pneumonia and bronchiolitis. Synagis works by targeting the RSV virus and preventing it from replicating in the body. It is administered as a monthly injection during the RSV season, which typically begins in the fall and lasts through the spring. The medication provides temporary protection against RSV, reducing the risk of severe illness and hospitalization. It is important to note that Synagis is not a vaccine and does not provide long-term immunity against RSV. Each dose of Synagis offers protection for about a month, so it is necessary to receive monthly injections throughout the RSV season to maintain its effectiveness. Who needs Synagis? Synagis is typically prescribed for infants and young children who are considered at high risk of severe RSV infections. This includes premature infants born before 29 weeks of gestation, infants with chronic lung disease or certain heart conditions, and children with certain genetic or immunodeficiency disorders. The decision to prescribe Synagis is usually made by the child's healthcare provider based on various factors, including the child's gestational age, overall health, and the prevalence of RSV in the local community. It is essential to discuss your child's individual risk factors with your healthcare provider to determine if Synagis is appropriate for them. Benefits of Synagis. The primary benefit of Synagis is its ability to reduce the risk of severe RSV infections in vulnerable infants and young children. RSV can be particularly dangerous for premature babies and those with underlying health conditions, as their immune systems are not fully developed or may be compromised. By receiving Synagis, these high-risk individuals have a better chance of avoiding hospitalization and serious complications associated with RSV infections. Studies have shown that Synagis can significantly decrease the rate of hospitalization due to RSV infections in eligible infants. It is estimated that the medication can reduce the risk of hospitalization by up to 55% in premature infants and up to 45% in children with chronic lung disease. This reduction in hospitalizations not only protects the child from potential harm but also alleviates the burden on healthcare resources. However, it is important to remember that Synagis is not a guarantee against RSV infections. While it significantly reduces the risk, there is still a possibility for breakthrough RSV infections. Therefore, it is crucial to take additional preventive measures, such as practicing good hand hygiene and avoiding close contact with individuals who are sick, to further protect your child. Potential side effects of Synagis. Like any medication, Synagis may come with potential side effects. While these side effects are generally rare, it is important to be aware of them and discuss any concerns with your healthcare provider. The most common side effects reported with Synagis include redness, swelling, or tenderness at the injection site, as well as a mild fever or irritability. In rare cases, more severe side effects may occur. These can include allergic reactions such as difficulty breathing, rash, or swelling of the face, lips, or tongue. If your child experiences any unusual symptoms after receiving Synagis, it is important to seek medical attention immediately. It is worth noting that the benefits of Synagis in preventing severe RSV infections generally outweigh the potential risks of side effects. Your healthcare provider will carefully consider your child's individual situation and weigh the benefits and risks before recommending Synagis. How does Synagis work? Synagis works by targeting a specific protein on the surface of the RSV virus called the fusion protein. This protein plays a crucial role in allowing the virus to enter and infect cells in the respiratory tract. By binding to the fusion protein, Synagis prevents the virus from entering the cells, effectively neutralizing its ability to replicate and cause infection. Synagis is a monoclonal antibody, which means it is derived from a single clone of immune cells and is designed to mimic the body's natural immune response to the virus. By introducing these antibodies into the body, Synagis helps provide passive immunity against RSV, offering temporary protection during the RSV season. It is important to note that Synagis is specific to RSV and does not provide protection against other respiratory viruses or common colds. Therefore, it is still important to take standard precautions to reduce the risk of respiratory infections, such as practicing good hand hygiene and avoiding close contact with individuals who are sick. How is Synagis administered? Synagis is administered as a monthly injection, usually given in the thigh muscle or upper arm. The injection is typically performed by a healthcare professional, such as a nurse or doctor, who is experienced in administering medications to infants and young children. The injection site may feel sore or tender for a short time after the injection, but this discomfort usually subsides quickly. It is recommended to talk to your healthcare provider about appropriate pain management strategies, such as applying a cold compress or giving a mild pain reliever, if needed. The dosing schedule for Synagis depends on the local RSV season and the specific recommendations of your healthcare provider. In general, Synagis injections start before the RSV season begins and continue monthly until the end of the season. It is essential to follow the recommended schedule and not miss any doses to ensure optimal protection for your child. Synagis dosage and schedule. The dosage of Synagis depends on the weight of the child. The medication is typically administered at a dose of 15 mg per kilogram of body weight. Your healthcare provider will calculate the appropriate dosage based on your child's weight and adjust it if necessary. As mentioned earlier, Synagis is administered on a monthly basis throughout the RSV season. The specific duration of the RSV season can vary depending on the region and local climate. Your healthcare provider will provide you with the exact start and end dates of the RSV season and schedule the Synagis injections accordingly. It is important to keep a record of the dates when your child receives Synagis injections and communicate any missed doses to your healthcare provider. If your child misses a scheduled dose, it is crucial to contact your healthcare provider as soon as possible to make arrangements for a makeup dose if necessary. Cost and insurance coverage for Synagis. The cost of Synagis can vary depending on various factors, including the dosage required for your child and the number of doses needed throughout the RSV season. It is essential to check with your healthcare provider and insurance provider to understand the specific cost implications for your situation. Many insurance plans cover Synagis for eligible infants and children, as it is recognized as an important preventive medication. However, it is important to verify your insurance coverage and understand any potential out-of-pocket costs, such as copayments or deductibles, that may apply. If you have concerns about the cost of Synagis or difficulties accessing the medication, it is advisable to reach out to your healthcare provider or insurance representative for assistance. They may be able to provide guidance and explore options to ensure your child can receive the necessary treatment. Frequently asked questions about Synagis. Is Synagis a vaccine? No, Synagis is not a vaccine. It is a medication that provides temporary passive immunity against RSV infections. Can Synagis prevent all RSV infections? While Synagis significantly reduces the risk of severe RSV infections, it does not provide complete immunity. There is still a possibility of breakthrough infections, albeit with a lower likelihood of severe illness. What are the common side effects of Synagis? The most common side effects of Synagis include redness, swelling, or tenderness at the injection site, as well as a mild fever or irritability. How long does Synagis protect against RSV? Each dose of Synagis provides protection for about a month. Monthly injections are needed throughout the RSV season to maintain its effectiveness. Can Synagis be given to older children or adults? Synagis is specifically indicated for infants and young children who are at high risk of severe RSV infections. It is not recommended for older children or adults. Conclusion. Synagis is an important medication that offers protection against severe RSV infections for vulnerable infants and young children. By understanding the benefits and potential side effects of Synagis, you can make informed decisions about its use in consultation with your healthcare provider. While Synagis significantly reduces the risk of hospitalization and severe complications associated with RSV infections, it is important to remember that it is not a guarantee against all RSV infections. Additional preventive measures, such as practicing good hand hygiene and avoiding close contact with sick individuals, should still be followed. By staying informed and actively participating in discussions with your healthcare provider, you can ensure the best possible care for your child's health and well-being. Together, we can protect our little ones from the risks of RSV and promote their overall health. Thanks for watching.